Imagine, it's in the middle of a pandemic. Schools are closed. Hospitals are overrun with COVID patients. A young mom is home with her 2 kids because she is an art teacher. Her days are spent taking her 4 and 2-year-olds to the park, playing outside. And then she notices her 2-year-old has a swollen face. After many trips to the doctor for a sinus infection, she insisted it was something else, so an MRI was ordered. Within an hour, Abram and his mom are rushing to the Atlanta Children's Hospital in an ambulance, and she is living her worst nightmare. Good morning. I'm Price Jarvis.
I'm Holland Jarvis.
And I am Courtney Gilbert, and we're from the Colquitt County High School. We are here to educate you on the importance of wearing a mask during these troubling times.
Our Colquitt County High School art teacher, Miss Pitts, is struggling with the pain and misfortune of having her 2-year-old son, Abram, treated for alveolar rhabdomyosarcoma, which is a soft tissue cancer otherwise known as ARMS, and is currently undergoing chemo. Due to his compromised immune system, it is important that he is not exposed to any illnesses, including our newest virus, COVID-19. Miss Pitts has been put in a very difficult situation, having to demand that every student in her class wear a mask. Most students don't have a mask or forget theirs at home. Unfortunately, she is not able to buy a mask for every student, so we began making masks that she could provide her students with when needed.
Many people don't truly understand the risk, not only to yourselves but to others around you, if you are not wearing a mask in public. In the past month from Colquitt County, kids from the ages of 5 to 17 years old have had 22 confirmed positive cases for COVID-19. Adults from 23 years old and above have had 223 confirmed cases just in the last month. To this date, there have been 2,599 positive cases in our county, varying from different age groups and still increasing. Most students don't realize the true heartbreak many people have experienced from losing beloved family members and friends to this horrific pandemic. From August 1st to now, Colquitt County has encountered 25 confirmed deaths, 25 people that left too soon. Going through this pandemic, it is important for communities to come together to get rid of this virus.
Some people, just like Abram, are in critical condition and can't afford to catch COVID-19. Globally, there have been 1,280 positive cases for cancer patients and 70 deaths. 480 children have had to have their chemo treatments put on hold due to being positive for corona, and 70 have had to have it reduced. Miss Pitt's family worked hard to keep Abram and themselves corona-free. She did not start back school until November after Abram's radiation treatments were completed. She has to travel to Atlanta every Friday with him for his chemotherapy treatments. Upon her return, she expressed her concern over her students wearing a mask in her classroom. As December came, the students were forgetting their masks, and she was buying disposable masks for them to wear in her class.
As a community in our school system, we have set out to make 140 masks, 6 bags of 25 in each, for every one of Miss Pitt's students so that she can do her job peacefully, knowing that she is not putting her son in danger. We have also put up posters around the school and made announcements stressing the importance that our student body wears a mask. During our FCCLA meetings, we have spoken about our presentation and what it means to us. Social media has also been a method of spreading the word by posting on our FCCLA platforms, Stop the Spread and Be the Solution, Not the Problem.
Our plan began in December when we decided to get fabric, elastics, and nose pieces, costing a total of $100. From there, we used sewing machines to create all of the masks. Through everything that we have done, my peers and I have come to understand that not everyone is as fortunate as we are. It is always important to think about others and what they could possibly be going through. Our school community has come together by wearing masks in the halls and in the classrooms.
Through this project, we have learned how wearing masks can help us in our family and consumer science classes and how it relates to facts. When working in the food lab, we should wear masks to keep from contaminating other people's food. Doing so sets an example for others. Also in restaurants, masks are an important part of food safety. By wearing masks in the hallways and classrooms, we are demonstrating a safe and healthy learning environment for children, youth, and adults. Keeping people corona-free is a high priority of ours because being isolated for long periods of time can affect people's emotional health. Also, time out of the classroom affects people's learning environment. Some homes do not have access to the internet, and these students are falling behind in their intellectual development.
Going out in public is a safety concern for people like Abram who have health issues. By not wearing a mask or going around people while you're sick can impact someone's life physically and mentally. COVID is a very serious illness because it affects everyone's body differently. Some people are born with critical health issues, and if they catch COVID, they are more likely to react worse than others because of their compromised immune system.
By wearing a mask, we are taking precautionary measures to analyze strategies that promote growth and development across a lifespan. Some people argue that masks are aggravating and do not work, but masks benefit the wearer and the other person. Masks are a source of control during this pandemic, limiting the amount of germs you come in contact with. When people are quarantined, they could experience anxiety and stress from being alone and feeling isolated. Not knowing how your body will react to COVID causes more concerns.
As a follow-up to our project, we created a survey for students and teachers at our school. The results were 28% wear a mask all the time now, 43% wear a mask when they have to, only 14% never wear one, 49% carry around and use hand sanitizer, 21% wash their hands after every class, 48% wash their hands 2 to 3 times daily. Overall, we feel like the project was a success, and we will continue our Stop the Spread campaign. While we are battling this pandemic, it's important to remember the 3 W's. Wash your hands, watch your distance, and wear your mask. By wearing masks, you are preventing exposing someone to your germs. You can keep yourself healthy, you can keep others safe, and you can save lives every day.
To answer our follow-up questions, what is one skill that you learned or improved upon during your project that you will use in next school year or in your future career? We have learned teamwork and how to collaborate among us to complete the project. We have also improved our research skills that will help us going into next year.
Number 2, what obstacles caused challenges in your work and how did you address them? Some obstacles we faced were our school system was shut down due to quarantine, so we had to adjust to Google Meets to work on our project. We also had to learn how to make masks in the most efficient way for the wearer. Thank you.